everybody, this is Dr. Warren Kalkstein here with Miss Brenda. Miss Brenda and I've been fortunate enough to get to work with Brenda over the last 5-6 years here in Towson as a chiropractor. So she's been coming in. We've been working through hip problems in the past, and we were prepping for the surgery that she had a total replacement on her hip. So we did a lot of the rehab before and afterwards.
Right.
And she's been seeing the chiropractor, Dr. Jeff, for a little while, right?
Dr. Jeff, and prior to that I saw Dr. Adolf.
Did you?
I started out with Dr. Adolf, and then when he got sick, Dr. Jeff came in.
Gotcha.
And was his assistant. So then I started with, after he got sick, then I started with Dr. Jeff.
Dr. Jeff, and that would be the late 80s probably.
Yep.
So
Been a
Dr.
long
Adolf
time.
was the chiropractor with Colts back in the day, and then in this area he was very helpful to a lot of people. Everyone knew him. And then Jeff took over the practice in the late 80s, early 90s, or we started working with him, and then I've been with my father here in Towson for the last 6 years, and there's now 7 of us chiropractors. But more important and way more interesting than our history is your history, right? You're so active. I loved hearing about what you've done in a week. She takes care of 3 little kids. She works the state fair, which is like 4 straight weeks of. I should probably let you tell.
Well, I worked at the state fair, and we started on August the 12th through September the 11th. I worked a total of 257 hours.
So
in that time. And
for like a 30-year-old, that's all right, get to work kid, right? But for like a 55-year-old like we got here, right? In order,
55.
To make that happen.
Want to add a lot of years to that.
Come on. All right, but you live it young for sure, and I appreciate her for that. And she's always on the move. She's always taking care of things. She's always got responsibilities at home. But I
take
think
care of a 91-year-old gentleman. I do
other
cooking
people.
for him, take him to the doctors. Do some house cleaning for him, do all my yard work, do all my house cleaning.
Take care of little girls on the side
Take care of the 1-year-old.
1-year-old, then you had 2
And then
before that, right?
Prior to that, I had their sister, which was is now 4. Well, I started with her 2 sisters when they were 6 weeks old, and I kept them until they went to school and preschool.
It's amazing. And I'm if I could speak a little bit about the practice, how has it helped you over the years relative to just kind of your activity?
It's kept me going. Actually, I started with Dr. Adolf because I was having problems with my shoulder and neck, and I said to him, how do I stop doing this? And he says, well, unless you want to change your job because you're sitting with your head cocked with the phone while you're trying to do paperwork and everything. He said, then it's never going to stop, but we can help you. So he would do the adjustments, and I'd come back every once in a while when it bothered me, and that's what I do now. If I have any problems, I call up and say, I need to have an adjustment. I need to have my head put on straight. That's what I jokingly tell all my friends. I have to go get my head put on straight. But it does help. Chiropractic services does really help.
Well, I'm glad, and I really think that it's a unique relationship we have with her as it relates to just kind of, she's built up that rapport with us and built up that ability for us. We just know her. We've been treating her for a long time, and it's easy for her to get in and just get help when she needs it. So we're grateful to be in a position to help somebody that helps so many other people and serves so many people. So.
And I do baking. I bake cookies for Christmas. 5 different kinds of cookies. 5 days a week. I'll bake cookies all day.
We get blessed by some of those cookies as well, which I appreciate.
Which is a gift, my Christmas gift to my family. So I'm always on the go. I'm always doing something.
And I think it keeps you going, right, in a good way. And I think it's just something to think about relative to
keep moving. I always tell everybody, if you keep moving, then maybe nothing can catch up to you.
There it is.
That's my motto.
Let's go. I appreciate you. And we're going to show. She was complaining of some calf tension and some pain that's been waking her up at night, some spasms in the calf. I did some soft tissue work with her when she came in last week. And I said, hey, come back in. We've got this new device that's really helpful for a lot of different soft tissue related problems. Most of it is going to be treating like a golfer's elbow, tennis elbow, plantar fasciitis, frozen shoulder, tendinopathies. It also treats muscle spasms and trigger points. It's like think of like a level up of a Theragun, like maybe 3 levels up in the way it penetrates. So Madison's going to show you the treatment on her calf. We did soft tissue work. It's feeling a little bit better, so I think this is going to help you out even more relative to that. And
everything that you do always helps. So
appreciate that. I'm glad, and you can always give me feedback when it's not the case, right? I'm here to help you. So
right.
Thanks for catching up with Brenda and seeing what she does. Hopefully we can take some of that and apply it to our own lives. and then
Just keep moving.
yeah, baby.
Keep doing.
I will see you guys. Thank you for watching. Brenda, thanks for talking.
You're quite
Enjoy the
welcome.
treatment, and I'll catch up with you when you get in here
Okay.
next. You're as needed. Okay.
Okay, see you in a month.
So what we're gonna start with is the vibration therapy. It kind of just feels like a Theragun without it like pounding on the skin. So like think of like your phone's vibrating on your arm or something. That's kind of what it feels like. And she's getting it in her calf or her up here, down here as well. Bothering you?
Yeah,
Okay.
it's more or less in the middle, but
Okay. This won't really feel like anything. Just kind of like vibrations. This isn't the other stuff. But kind of just moving it around, getting the tissue ready for the other radial pulse.
we didn't even know.
So are you doing radio pulse after?
Yeah. So vibration first gets this the part of the body ready for like the other like shocking vibration part of it. And then radio pulse comes after. So then we hit exit. We put this lovely gel on her. It might be a tad bit cold. Is it up top more or down low?
Sort of in the middle.
Right here?
Is it along the side here, or is it more in the back here? Show me where it is on my back. Yeah, right.
This is a lovely radial pulse pressure wave. Sturdy little thing. Just move the gel around. Sometimes they give us protocols for it, sometimes they don't.
I'm gonna do heat stim.
So with this one,
Give me 1 second.
it might have a protocol. The only thing we have is shin splints. So I get to make it up with radial pulse pressure. We can change the frequency, which is how many times it hits you, how many pulses you get. The standard is 2,000, and then the pressure is what we're gonna focus on. We'll start you up at 1 bar. Okay. Kind of sounds like this. Let me hit play. That's what it sounds like. We're gonna go over here, okay? You let me know if this is okay for you, okay? Is all that okay? And as she gets used to the feeling, we'll kind of increase it a little bit. So just keep going. And then you let me know if there's any spots that you can feel a little bit more than others, okay? Am I in the general area?
Does it hurt?
No.
And it counts down the pulses that it's doing. So it only does a certain amount.
Yeah, so each treatment area, the standard is about 2,000 pulses for a little area. You try not to go over it, but sometimes when you don't find this spot, like with her, she's not really giving me like a direct, like direction to go in. So like, there's not one spot that's irking her more than others to kind of focus in. That's why I'm just kind of moving it around, trying to find it. If usually we can't find it, we'll do another session just so we can get the area that's bothering her. And if there is an area that kind of bothers her more than others, then we'll focus a little bit more on that spot. Right here? right here. I'm gonna go again just because I finally found the spot that's bothering you. Yeah, I'll hit run again. We'll keep the same settings as that was because that's what was bothering. It was a good spot. Press play.
It is a little lower.
And then we'll start a little bit lower where the discomfort was, just so we're not starting right smack down on what's bothering her. And then we'll kind of move my way back up to where it was bothering her before. So right in here.
Okay, you have 2 stickies here, okay?
Alrighty. And that's all that's to it.
Feels good.
Feels good? I'm glad. I don't have a towel. Wipe this lovely thing off. I'm gonna wipe your calf off real quick,
okay.
get all that gel off of you.
Okay.
Does that feel okay?
Me to move them?
Alrighty, well, that's all that was to it. Feels great.
Good.
Feels amazing.
Yep.
I'm glad to
Came
hear.
up to me and said, put them right
Alrighty.
here.
I think you are good to go after that.
Okay.
Yeah, I'll set up another appointment.
In a month.
Once we
I
get
come
you
back
going,
for a month just for a routine checkup. Routine adjustment keeps me moving.
So he's adding stuff to you now.
Okay, good.
Not just an adjustment
Covering
anymore.
those pads.